We're on your side with tonight's cover story, fast-tracking care for cancer patients. Have you ever been to the emergency room? Well, I have several times, and it can get hectic at times, and you can wind up crowded among other sick or injured people waiting to be seen by a doctor. Now, that can be particularly dangerous for cancer patients who are immunocompromised. In fact, research shows nearly 80% of visits to the emergency room for patients on active chemotherapy can be avoided. What many are going to the ER for are the side effects of chemotherapy and radiation treatment. While an emergency room can handle those types of issues, cancer patients may be better off going to a specific treatment center in an emergency. Well, now Novant Health has a new program designed specifically for cancer patients who need emergency care, and that is tonight's cover story.
It's been a hard 2.5 years.
2.5 years of Connis Dyer watching her youngest child, Allie, battle an aggressive form of lymphatic cancer.
She's had numerous treatments. She has failed 5 lines of treatment, so it's a relentless disease.
Well, Allie is relentless herself, taking every treatment with stride and a smile. But some days are harder than others, especially when going through chemotherapy.
We found out had a propensity to run neutropenic fevers when your immune system doesn't exist because of the chemo. And so whenever she spiked a fever of over 100.4, she had to come into the ER.
It's common for patients going through chemo to have side effects such as nausea, pain, vomiting, diarrhea, as well as fever when a patient's blood count is low. And for many, an emergency room visit may be the first line of defense to treat those side effects. But if you've ever been to an emergency room, you know wait times can be lengthy. Another issue, there's also the risk of immunocompromised patients being exposed to other sick patients. That was a concern for healthcare providers at Novant, which led to changes being made.
Our emergency room colleagues got together with our inpatient nursing team and the inpatient physicians and developed this pathway for such patients to not have to be evaluated in the emergency department for those common ailments and go directly to a cancer specialty ward and be immediately treated by our expert team who's well experienced in managing such side effects.
Dr. David Rizzeri is the Senior Vice President and System Physician Executive for the Novant Health Cancer Institute. He's spearheading the ER bypass program at Novant Presbyterian Medical Center. It's a specialty floor staffed around the clock by a team of oncology-trained nurses, providers, and pharmacists. They can provide fast care to cancer patients so they can avoid the ER.
So when a patient who is on active therapy calls Care Connections with one of these concerns, the team is educated to recognize this patient may fall into this emergency room bypass pathway. And they make the call to the inpatient nurse manager and set the wheels in motion to identify that, yes, the bed's available, and the patient is told that they can immediately arrive through the front of the hospital right up to the direct admission bed waiting for them.
With patients getting direct care from specialists, many, if not most, can go home within a few hours after being admitted to ER bypass. And that's been a game changer for Connis and her family.
To be able to be taken up, to go straight up to the 7th floor, 7th F, which is the oncology floor, and know that they know exactly what to do, they know what to start, antibiotics, everything. It gives you a peace of mind.
A peace of mind Dr. Rizzeri wants other families to experience.
There's significant interest in expansion, and there's the ability to expand once we can be sure that it's going to be efficient, safe, and we have the proper staffing throughout not only our Charlotte market, but also the rest of the state where Novant has a large footprint.
Dr. Rizzeri adds this program is more cost efficient for cancer patients because they can avoid ER charges that are typically higher.